In good health, this may come as a disturbing fact to many women, but when you're under anesthesia, it is not illegal in Michigan for a medical student to perform a pelvic exam on you.
These exams, of course, for the student's education have come under increasing scrutiny. Dr. Frank George here with what women should really know before any of this happens.
Well, yeah, Kim and Devin, learning to do a pelvic exam is difficult and awkward for many medical students. In fact, most schools hire volunteers to have multiple exams in order to teach students and give them feedback on the proper approach to this really sensitive subject. But proficiency also requires experience, and that's where exams under anesthesia are important. The issue really here is consent.
Specifically for pelvic exams under anesthesia, the policy is clear that it has to be part of the procedure, that the patient knows that it is part of the procedure, and that explicit consent is obtained prior to the procedure.
Dr. Maya Hammoud is the Associate Chair for Education and Professor of Obstetrics and Gynecology at the University of Michigan, where there has been a long-standing policy covering this. In fact, a 2003 study titled Don't Ask, Don't Tell, done in part by a physician at the University of Michigan, was one of the first articles raising the importance of obtaining consent for pelvic exams under anesthesia for training purposes. The article emphasized the need for explicit patient consent and served as supporting documentation to develop laws that ban or regulate intimate exams for teaching purposes in many different states. Currently, California, Illinois, Virginia, Oregon, Hawaii, Iowa, Maryland, Utah, New York, and Delaware have such laws. Michigan does not have any laws covering the practice, and it's left up to the individual teaching hospitals to regulate it.
Women should always ask their physicians any questions they have about anything, any treatment. And I certainly hope women feel empowered that if they have any concerns about this, that they actually will bring it up with their physicians.
Now, this does cross into other areas as well. If a man is having a prostate surgery, for example, it is similarly not uncommon to have medical students examine the patient to learn the nuances of an abnormal prostate exam. So it is not only a female issue, it is about consent and patient autonomy.
Yeah.
So what policies are in place at other hospitals?
Well, we actually contacted many local teaching hospitals today. Now, Henry Ford Hospital has a blanket policy requiring consent for any procedures being performed by medical students. We're still waiting to hear responses from other teaching hospitals in our area. But I do want to mention, even when consent is given, these are supervised exams and they need to be relevant to the procedure that's being done. So a pelvic exam when you're having heart surgery, for example, would not be appropriate. These are very specific situations, but it's really about, again, consent, patient autonomy.
Understanding it. Yep. All right, Doc.